There are four valves in the heart, and the aortic valve is the outlet from the left ventricle. All of the blood that your heart is pumping to your body has to go through the aortic valve. And two things can go wrong with a valve. It can either leak or it can become narrowed. And aortic insufficiency or aortic regurgitation is a diagnosis that means a leaky aortic valve. Most patients with leaky aortic valves have a valve that was abnormal from birth, but there are other processes, including infections and trauma, that can cause an aortic valve to leak. If you have aortic insufficiency, what that means is that some portion of the blood that your heart pumps with each beat leaks back into the heart through the leaky valve. And therefore, in order to provide enough blood flow to your body, your heart has to compensate for that by pumping a higher than normal amount of blood in order to make up for what leaks back into the heart. And it can do that in two ways. It can either beat faster, which is not particularly good for the heart, or it can pump more with each beat by enlarging and pumping a higher volume. And that too is working harder than it would normally. Now, there's a great deal of reserve capacity built into your heart, as there is in all of your body systems. So for quite a while, your heart may be able to compensate for the leaky valve, and particularly if that leak is not severe. But over time, a leaky valve tends to leak more. And as the heart enlarges, the valve tends to leak more as well. And after a certain point, the enlargement of the heart further enlargement of the heart is no longer possible, and the heart begins to fail. At that point, the process is to a large extent irreversible, and you may be looking at something as severe as a heart transplant in order to recover. And therefore, we recommend that if the leak is bad enough, and if the heart, and particularly if the heart is showing any signs of decompensation, that valve be treated. And recently, it's been shown that waiting until you have symptoms, and the symptoms may be as mild as a little bit of shortness of breath or a little bit of fatigue, but even that degree of symptom means that things are pretty far down the road and that your heart is already starting to fail, and that your results of surgery at that point are not going to be as good as if we had intervened earlier. And that's why with aortic insufficiency, as with most heart valve diseases, we will want to follow you with echocardiograms to determine when the best time to operate is going to be. When a valve leaks, it used to be that the only solution would be to replace the valve with an artificial valve. And that is still possible, but artificial valves carry certain disadvantages. If you use a mechanical valve, you need to be on a blood thinner medicine called Coumadin. If you use a tissue valve to replace the leaky valve, then that valve is going to wear out at some point down the road. And for a younger patient, which is generally the type of patient who has a leaky aortic valve, the tissue valve will wear out when they're still young, and they'll be looking at multiple operations down the line. One option to a valve replacement in many patients with leaky aortic valves, with aortic insufficiency, is aortic valve repair. The advantage of aortic valve repair is that it uses your own aortic valve tissue, and therefore it's not going to wear out like a pig valve or cow valve would, and it doesn't require you to be on any sort of special medicine. No blood thinner medicines are necessary. And it's been shown that in most cases, repaired aortic valves are quite durable. and many patients will have a repaired valve last the rest of their life. And if we repair your aortic valve before your heart starts to fail, we would expect that your life expectancy would return to normal and that your heart would continue to function normally. Aortic valve repair is a procedure that would be considered open heart surgery. In order to do the operation, we connect the patient to a heart-lung bypass machine. Usually this is done through an incision in the middle of the chest called a sternotomy through the breastbone. And many times this operation can be done through a small version of that incision, just through a portion of the breastbone. Once on the heart-lung machine, we stop the heart from beating so that we can see and work on the heart while it's not moving. During that time, you're supported by the heart-lung machine. We would open the aorta to get a good look at the valve and assess whether the valve is repairable and what needs to be done. In most cases, the repair involves placing an artificial ring, something called an annuloplasty ring, to support the repair, and then the leaflets or flaps of tissue are repaired with a variety of sutures. The whole operation usually takes 3 hours or so. It may take a little longer. Most patients spend overnight in the intensive care unit and then about 3 or 4 days in the hospital. We have done a small number of these operations without splitting the breastbone using a robotic approach, and we feel that this is a very promising way to do aortic valve repairs. Recovery after aortic valve repair generally involves about 3 or 4 days in the hospital, sometimes a bit longer, and then about 4 weeks to start feeling pretty good again, and maybe 8 to 10 weeks to get back to 100%. With a sternotomy, it's like having a broken bone anywhere else. Time to full healing of the bone is about 8 weeks. And that's pretty much the determining factor for the time to be able to go back to work if you have a physical job or get back to full activity. Patients who have a robotic approach have all the same in-hospital routines, but often are able to get out of the hospital a day or 2 earlier than if they had had a sternotomy. The recovery after leaving the hospital also tends to be a bit quicker because they don't have to wait for the bone to heal. So many patients who have the robotic approach are able to get back to full activity within about 6 weeks of the operation. After you go home and throughout your recovery, we'll be available to answer any questions and manage any issues that arise during your recovery. That postoperative visit usually happens 3 to 4 weeks after you go home from the operation. At that visit, we'll check and make sure everything is healing well. We will do an echocardiogram to look at your heart valve and your heart in general, as well as a chest X-ray and EKG. If all of those things look good, you'll be cleared for a return to full activity. We will want to see you periodically in the future, usually once a year, with follow-up echocardiograms to make sure that everything still looks as it should. We have seen some of our patients with aortic valve repairs back for several years now, and we believe that aortic valve repair is a very durable way of treating aortic valve disease.